Hello and welcome to the Dr. Irene Y. Ansah channel. I'm Dr. Irene Y. Ansah, and I'm delighted to have you here with us today for a profound exploration into the world of attention deficit hyperactivity disorder, commonly known as ADHD. In this enlightening video, we embark on a journey to unlock the mysteries surrounding ADHD. Our aim is to provide you with a comprehensive understanding of 1. Causes. We'll start by unraveling the diverse factors that contribute to ADHD. Understanding the origins of this condition is crucial for developing effective strategies and support. 2. Symptoms. ADHD manifests in a variety of ways, affecting attention, hyperactivity, impulsivity, and executive function. We'll delve into the key symptoms, helping you recognize them and their impact. 3. Effective strategies. Living with ADHD can present unique challenges, but there are effective strategies and interventions that can improve the quality of life for individuals affected by this condition. We'll explore a range of approaches tailored to specific needs. Whether you're a parent, educator, caregiver, or someone personally touched by ADHD, this video is a valuable resource. It's our mission to empower you with insights and information that can make a positive difference in the lives of individuals with ADHD. Before we dive deeper into this topic, I invite you to subscribe to our channel and click the notification bell. By doing so, you'll stay updated on our future videos, where we explore critical topics in neurology, neurodevelopmental disorders, and compassionate care. Now, without further ado, let's unlock the mysteries of ADHD, starting with overview of ADHD. Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that primarily affects children but can persist into adolescence and adulthood. It is characterized by a pattern of symptoms involving difficulties with attention, hyperactivity, and impulsivity that interfere with daily functioning and developmentally appropriate behavior. Here are the core features and characteristics of ADHD. 1. Inattention. Individuals with ADHD often struggle with sustained attention and focus on tasks or activities. They may have difficulty organizing their thoughts and belongings, paying attention to details, and following through on tasks, chores, or assignments. It can be challenging for them to complete schoolwork or work-related tasks that require concentration. 2. Hyperactivity. Hyperactivity in ADHD is marked by excessive and often restless physical activity. This can include fidgeting, tapping, or squirming when seated, restlessness in situations where it's expected to be quiet, and an inner feeling of restlessness. In children, this hyperactivity often manifests as running or climbing when it's not appropriate. 3. Impulsivity. Impulsivity involves acting without thinking about the consequences. Individuals with ADHD may blurt out answers before a question is completed, interrupt others in conversations, or have difficulty waiting their turn. This impulsivity can lead to social difficulties and problems in relationships. It's important to note that ADHD is a complex and heterogeneous condition, meaning that it can present differently in different individuals. ADHD is further classified into 3 subtypes based on the predominant symptoms. 1. Predominantly inattentive presentation. This subtype is characterized by primarily inattentive symptoms, such as difficulty focusing, staying organized, and following through on tasks. 2. Predominantly hyperactive impulsive presentation. This subtype is characterized by predominantly hyperactive and impulsive symptoms, with less pronounced inattentive symptoms. 3. Combined presentation. This is the most common subtype and includes a combination of inattentive, hyperactive, and impulsive symptoms. The exact cause of ADHD is not fully understood, but it is believed to be influenced by a combination of genetic, neurological, environmental, and developmental factors. Brain imaging studies have shown differences in the structure and function of the brain regions responsible for attention and impulse control in individuals with ADHD. ADHD can have a significant impact on various aspects of an individual's life, including academic performance, social relationships, and overall quality of life. However, with proper diagnosis and appropriate interventions, individuals with ADHD can learn to manage their symptoms effectively and lead successful, fulfilling lives. Treatment for ADHD typically includes a combination of behavioral therapies, educational support, and, in some cases, medication. Behavioral interventions can help individuals develop strategies for managing their symptoms, while medication may be prescribed to improve attention and impulse control in some cases. It's essential for individuals with ADHD to receive a comprehensive evaluation and personalized treatment plan tailored to their specific needs and challenges. Early intervention and ongoing support can make a significant difference in their ability to thrive and succeed. Now that we've embarked on our journey to understand ADHD better, it's time to unlock the mysteries behind its causes. ADHD is a complex neurodevelopmental disorder, and understanding the factors that contribute to its development is crucial for providing effective support and intervention. Causes. 1. Genetic factors. Research has shown that genetics plays a significant role in the development of ADHD. Individuals with a family history of ADHD are at a higher risk of developing the condition themselves. Studies have identified specific genes that are associated with ADHD, although it's not solely determined by genetics. 2. Neurological factors. The structure and function of the brain are central to understanding ADHD. Neuroimaging studies have revealed differences in the brains of individuals with ADHD, particularly in areas related to attention, impulse control, and executive functions. These differences may be influenced by genetics and other factors. 3. Environmental factors. Prenatal and early life environmental factors can contribute to the risk of developing ADHD. Exposure to substances such as tobacco smoke, alcohol, or certain toxins during pregnancy may increase the likelihood of ADHD. Premature birth and low birth weight are also associated with a higher risk. 4. Brain development. The development of the brain, particularly the prefrontal cortex, which is responsible for executive functions like attention and impulse control, can be affected in individuals with ADHD. Delayed or atypical brain development may contribute to the disorder. 5. Psychosocial factors. Stressful or adverse psychosocial experiences, such as trauma or a chaotic home environment, can exacerbate ADHD symptoms. While these factors may not directly cause ADHD, they can make managing the condition more challenging. 6. Diet and nutrition. While the role of diet and nutrition in ADHD is still under investigation, some studies suggest that certain dietary factors, such as artificial food additives and a high-sugar diet, may worsen symptoms in some individuals. However, these findings are not universal, and dietary interventions should be approached cautiously. 7. Other factors. Some research explores the potential role of factors like maternal smoking during pregnancy, lead exposure, and prenatal infections in increasing the risk of ADHD. However, further studies are needed to establish clear connections. It's important to note that ADHD is a complex and multifactorial disorder. The interplay of genetic, neurological, environmental, and developmental factors varies from person to person. Additionally, not everyone with genetic predispositions or risk factors will develop ADHD. Understanding the causes of ADHD is a critical step in developing effective interventions and support strategies. It allows healthcare professionals, educators, and families to tailor treatments and accommodations to meet the unique needs of individuals with ADHD. As we continue our journey into understanding ADHD, it's vital to shed light on the hallmark symptoms that characterize this neurodevelopmental disorder. By recognizing these symptoms, we can better identify and support individuals affected by ADHD. Symptoms. 1. Inattention. Inattention is a core feature of ADHD. Individuals with ADHD may struggle to focus on tasks or activities that require sustained attention, such as schoolwork or work-related tasks. They often make careless mistakes, have difficulty organizing their thoughts and belongings, and may seem forgetful or disorganized. 2. Hyperactivity. Hyperactivity involves excessive and often restless physical activity. While hyperactivity is more prominent in children, it can also manifest as a sense of restlessness in adolescents and adults with ADHD. Children may run or climb when it's not appropriate, while adults may feel restless or fidgety. 3. Impulsivity. Impulsivity refers to acting without thinking about the consequences. Individuals with ADHD may blurt out answers before a question is completed, interrupt others in conversations, or have difficulty waiting their turn. Impulsivity can lead to social difficulties and problems in relationships. 4. Distractibility. Distractibility is closely related to inattention. Individuals with ADHD are often easily distracted by irrelevant stimuli in their environment. They may have trouble staying on task and frequently shift their attention to unrelated thoughts or activities. 5. Difficulty with organization. Problems with organization are common in individuals with ADHD. They may struggle to keep track of their belongings, complete tasks in a systematic way, or follow through on commitments. This can affect their academic and work performance. 6. Forgetfulness. Forgetfulness is another common symptom. Individuals with ADHD may frequently forget important appointments, deadlines, or daily responsibilities. They may have difficulty remembering to do chores or tasks, even when they are aware of them. It's important to note that the presentation of ADHD symptoms can vary from person to person and may change over time. Additionally, some individuals may primarily exhibit inattentive symptoms, while others may display more hyperactive impulsive symptoms, or a combination of both. Recognizing these hallmark symptoms is the first step in identifying ADHD. If you or someone you know displays these symptoms consistently and to a degree that significantly impairs daily functioning and developmentally appropriate behavior, it may be time to seek an evaluation from a healthcare professional. In the next section of our journey, we'll discuss the importance of early diagnosis and intervention in managing ADHD effectively. We'll explore why catching ADHD early can be a game changer in an individual's life. As we continue our journey into the world of ADHD, it's crucial to shine a light on a game-changing aspect of managing this condition: early diagnosis and intervention. Understanding why catching ADHD early can be a game changer in an individual's life is pivotal for their well-being and success. 1. Academic success. One of the significant areas where early intervention is critical is in education. Children with ADHD often struggle in school due to difficulties with attention, organization, and impulse control. Recognizing and addressing these challenges early can help provide the necessary support and accommodations for academic success. 2. Self-esteem and confidence. Children and adolescents with untreated ADHD may face repeated failures and frustrations. This can take a toll on their self-esteem and confidence. Early intervention helps them develop coping strategies, learn to manage their symptoms, and build a positive self-image. 3. Social skills. Social interactions can be complex, and individuals with ADHD may encounter difficulties in forming and maintaining friendships. Early intervention can include social skills training, which equips them with the tools to navigate social situations effectively, improving their overall quality of life. 4. Family dynamics. ADHD doesn't just affect the individual, it impacts the entire family. Early diagnosis allows families to access resources, support groups, and educational materials to better understand ADHD and develop effective strategies for managing it within the family unit. 5. Preventing coexisting conditions. Untreated ADHD can increase the risk of coexisting conditions such as anxiety, depression, and substance abuse. Early intervention can help reduce the likelihood of these complications by addressing ADHD symptoms and providing appropriate support. 6. Long-term outcomes. Early intervention sets the stage for more positive long-term outcomes. With the right support, individuals with ADHD can develop valuable life skills, pursue higher education, and excel in their careers. 7. Medication management. In some cases, medication may be part of the treatment plan for ADHD. Early diagnosis allows healthcare professionals to explore medication options when appropriate and tailor the medication to the individual's needs. 8. Quality of life. Ultimately, early intervention improves the overall quality of life for individuals with ADHD. It empowers them to reach their full potential, pursue their goals, and lead fulfilling lives. It's important to remember that ADHD is a lifelong condition, but with early diagnosis and intervention, its impact can be significantly mitigated. Early support and strategies empower individuals with ADHD to thrive and excel in various aspects of life. If you suspect that you or someone you know may have ADHD, seeking an evaluation from a healthcare professional is a crucial first step. The sooner ADHD is identified, the sooner appropriate interventions can be implemented to make a positive difference. As we delve into the world of ADHD, it's essential to equip ourselves with effective strategies to support individuals with this condition in unlocking their full potential. ADHD presents unique challenges, but with the right approach, individuals can thrive. Effective strategies. 1. Behavioral therapy. Behavioral therapy is a cornerstone of ADHD management. It helps individuals develop essential skills and strategies for managing their symptoms. Techniques such as cognitive behavioral therapy, CBT, and behavior modification can be tailored to address specific challenges. 2. Medication management. In some cases, medication may be recommended as part of the treatment plan. Medications like stimulants and non-stimulants can help improve attention, impulse control, and hyperactivity. Medication management should be carefully monitored by a healthcare professional. 3. Organization and time management. Developing strong organizational and time management skills can significantly benefit individuals with ADHD. Tools like planners, calendars, and reminders can help structure daily routines and tasks effectively. 4. Environmental modifications. Creating an ADHD-friendly environment can make a significant difference. This includes minimizing distractions, having a dedicated workspace, and setting clear routines and expectations. 5. Social skills training. Social skills training can help individuals with ADHD navigate social interactions successfully. These programs focus on understanding social cues, active listening, and effective communication. 6. Exercise and nutrition. Regular physical activity and a balanced diet can have a positive impact on ADHD symptoms. Exercise helps release endorphins and improve focus, while a well-rounded diet can provide essential nutrients for brain health. 7. Mindfulness and relaxation techniques. Practices like mindfulness meditation and relaxation exercises can help individuals with ADHD manage stress and improve self-regulation. 8. Support groups. Support groups provide a sense of community and understanding for individuals and families affected by ADHD. Sharing experiences and strategies with others facing similar challenges can be empowering. 9. Parent and teacher training. Parents and educators play a crucial role in supporting children with ADHD. Training programs can help them understand ADHD better and learn effective strategies for managing behavior and academics. 10. Accommodations in education and work. Individuals with ADHD may benefit from accommodations in educational settings or the workplace. These accommodations can include extended time on tests, preferential seating, and flexible work arrangements. 11. Structured routine. Establishing a consistent daily routine can help individuals with ADHD better manage their time and tasks. Knowing what to expect can reduce anxiety and improve organization. 12. Self-advocacy. Teaching individuals with ADHD to advocate for themselves is empowering. Encouraging them to communicate their needs and preferences with teachers, employers, and healthcare professionals can lead to more tailored support. It's important to note that ADHD is a highly individualized condition, and what works best may vary from person to person. Tailoring interventions to the specific needs and challenges of individuals with ADHD is key to their success. By implementing a combination of these strategies and seeking professional guidance, individuals with ADHD can develop the skills and coping mechanisms needed to thrive in academics, work, and social interactions. As our journey through the world of ADHD comes to a close, I want to express my gratitude for joining us on this insightful exploration. We've covered crucial aspects of ADHD, from its causes and hallmark symptoms to the game-changing significance of early diagnosis and effective strategies for support. 1. Understanding and empathy. We began by unraveling the mysteries behind ADHD, understanding its causes, and recognizing its hallmark symptoms. Knowledge is a powerful tool in supporting individuals with ADHD. 2. Early diagnosis and intervention. We highlighted the game-changing impact of early diagnosis and intervention in the lives of those affected by ADHD. Early support empowers individuals to overcome challenges and build a strong foundation for success. 3. Effective strategies. We explored a wealth of effective strategies for managing ADHD, equipping individuals with tools and resources to thrive. These strategies address the unique needs of individuals and promote personal growth. 4. Supportive network. We emphasized the importance of a supportive network and community for individuals with ADHD. Understanding and empathy from family, friends, educators, and healthcare professionals play a vital role in their journey. 5. A message of hope. While ADHD presents challenges, it's essential to remember that individuals with this condition possess unique strengths and talents. With the right support, they can achieve their goals, pursue their passions, and lead fulfilling lives. I encourage you to share this video with others, spreading awareness and understanding of ADHD. Let's continue to foster a world where individuals with ADHD are embraced for their uniqueness and provided with the support they need to thrive. If you found this video informative and valuable, please consider subscribing to the Dr. Irene Ansah channel for more insights on neurology, neurodevelopmental disorders, and compassionate care. Thank you for being a part of our journey today. Your empathy, understanding, and commitment to learning are essential in creating a more inclusive and supportive world for individuals with ADHD. Until next time, take care, and let's continue our mission of spreading knowledge, empathy, and support for individuals with ADHD and their families. Remember, every person's journey is unique, and every voice deserves to be heard.